Welcome to the Let It Bleed podcast, a place where you can hear the liquor-fueled ramblings of two narcissistic wizards who conjure the essence of inspirational people every week and bring it straight to you.
Just how do you plan on doing that? Magic. Motherfucker.
And now for the wizards themselves, David Amaya and Phil Arroyo.
What's up, dude?
Oh man, happy apocalypse, my friends. How you doing?
Oh, come on. You really think it's the apocalypse?
Oh, dude.
Because, I can't tell, to be honest with you. Just because, it is a really confusing and crazily escalating time. Whether it's really, how much of it is warranted. I know we're going to talk about this. You're going to, go into this. But I feel like some people are freaking out, or a lot more people are freaking out more than what they need to be freaking out with a lot of other nonsense, in the wrong ways, I should say. They're doing the wrong, they're not being productive about this whole thing,
Well, yeah, that's definitely true. Actually, the bigger reason why I did want to get this out there today and focus on the one topic, because I'm actually seeing a lot of people who are not really preparing or don't have they really should be a little bit more worried than they are, because panic is not going to help anybody. All right. And us as individuals, and probably anybody listening to this individually, the chances of you being perfectly fine are pretty good, from a health perspective. But that is, kind of not the only thing to worry about. Yeah.
True.
And I think my favorite the way that I read somebody put it, what a fucked up sentence that was. Let me try that again. So my favorite way of summarizing the situation that I've heard so far is somebody said, Corona is a black light and America is a cum-stained hotel room. And
that's true.
That was the most eloquent way I think I have seen it summarized thus far. Because it's gonna be a problem. I don't know, how familiar are you with the situation in Italy or Iran?
Yeah, well, I know that Italy is on a complete lockdown. I understand that the stock market is going to fucking crash. I understand that people are they're canceling all the music festivals and everything already, and people are more freaked out about that than they seem to be about the virus and how quickly it spreads. But it's just really difficult, I think, for people to kind of understand how, what all that stuff is, because I think it's kind of escalating a lot quicker. They're focusing on the virus still too, but they don't really understand that it's kind of the freaking out about the virus that's going to create a lot of problems, for us. And I know that you're going to go into how it's affecting us, or how our current president is really fucking us over in this situation.
I don't even really want to dwell on that part too much, because I do feel like people know, but it can't be understated how much he has truly fucked us in this situation. But even a very competent president, let's say this happened and it was on Obama's watch, this still would be a very, very difficult situation, a national disaster.
Right.
There's really no way around it. And
right.
But
so go ahead.
If you made the worst possible decision at every point, that's going to be the difference between maybe a few 100,000 casualties versus millions, which is the road that I'm kind of half expecting right now.
And that's due to lack of hospitalization for people?
Well, here's the thing. Because, see, it's right now, timing is crucial. As anybody who's listening to this and as we're talking about it, it's Wednesday, March 11th right now. And really every day counts for a lot right now. Because what I think people are having a hard time wrapping their head around is the exponential growth of this stuff. Basically, everything kind of starts out slow, but things double every 6 days, So some of the basically some of the modeling I'm looking at and kind of going off of is projecting that we could probably have about 4 million cases by mid-May. So that's pretty significant. So the goal right now it's not to panic. It's not to despair, because that's really not going to help anybody. But we do actually all need to take action. And I could not be more serious when I say, like, this is incumbent on all of us to, to actually take these super necessary steps now, because we have the very good fortune of seeing how this played out in, the entire Eastern Hemisphere. And it's like, okay, cool. We know what to look for. We know what needs to get done to slow the spread of this thing. Because the truth is that we are probably going to get it. Me, you, probably people listening to this.
Well, what's to say that we don't already have it, Because I've heard before they started reporting in the last couple of days, someone shared with me a couple weeks ago, or about a week and a half ago, that there were already a few cases in Orange County. And I don't remember it being reported heavily at that time. And then, now it's starting to pop up.
Officially, this is again going back to the president, but they've actively suppressed testing, and they don't want people to get tests. Because if we actually were testing people at the scale that we need to be, then we would have understood very early on the problem that we were facing. We could have taken a lot more preventative measures. But what they've done is they've actually suppressed tests so nobody in the U.S. can get tested, so it looks like the U.S. has very few cases. But the thing is that...
What? Really? That's what they're doing?
That's what they're doing.
They're not allowing people to test? So people have tried to get tested.
You can't get a test right now. If
Really?
we definitely had it, we had every symptom, we could not get a test right now.
So then how are they confirming the cases that they have been so far?
Because state and local governments are just saying, okay, wow, we are not going to get any help from the federal government. And even still, some of them have some testing capacity, up in Washington now. They just kind of finally got it. The CDC is, obviously there's a giant clampdown on those. So, just to, we are ranking dead last in the developed world right now for people who are being tested. So let's see, at the top end, for every million people, South Korea is testing 3,692 people. For every million people, we are testing 5.
Yeah.
So we have, they're testing 10,000 people a day over there. As of March 8th, we had tested 1,700 people. And now, this
Go
is...
ahead.
Yeah. Okay. Well, I said I wasn't going to harp on this too much, but I think it is important to point out that our government rejected the test that was being passed around by the international community, trying to give people, a heads up. They rejected it because they wanted to make their own test, which they could charge for. And so they did that in January at the beginning of all this. And then they found out, oh shit, the test we made doesn't work. So they had to recall all of them and then scrap all that. So we didn't kind of get a start on making them until February, still rejecting the WHO ones. And now you can get a test for the low price of $3,000. So, yeah, that is the situation. This is the late stage capitalism hellscape that we have built. And this is why we've raged against this for so long. And this is why a lot of people are... they're going to die. So, I cannot... Again, I don't want to panic everybody, but the situation is really bad and nobody's acting like it's bad. So, here's what we got to do, okay? We need to know that, the biggest complications from all this is going to happen if too many people get sick at one time. All right. So this is happening. We're seeing this in Italy and we're seeing this in Iran. Basically, everybody kind of got sick. They did not take the measures that they needed to quick enough. And everybody got sick at the same time. Everybody rushes over to the hospital. And the hospitals get completely overwhelmed. And they literally don't have the capacity in the country to take care of those people. And then we see fatalities from it spike. And that's not just from coronavirus cases. It's from anybody trying to get into the hospital at that time. Because also this virus is hitting the healthcare workers in the front lines too, and that'll take them out of commission for 2 or 3 weeks. So we've got understaffed hospitals, not enough people to help out, and not enough beds to take care of anybody, not just those people. So that's the biggest problem that we got. The only way, what we need to do now is really take seriously all of these things that people are at least kind of familiar with now. Washing your hands, sterilizing your phone, staying away from each other, canceling large public events, not getting within 6 feet of anybody else, right? Because there's no way that we are going to actually stop this. It's out now. There's no containing it. So everybody's going to get it at some point. But what we can do is we can slow it down. So the more seemingly extreme measures that we take now, that is going to basically, there's this push right now for something called flatten the curve. Now the curve is, there's a graph with several trajectories, and unfortunately this is an audio medium, so you can't really see it, but you can imagine it basically outlines what I just explained, how everybody getting sick at the same time is going to overwhelm the system and crash it. So if we space it out, if you don't get sick for every day that you're not sick, not needing medical attention is a win. And every day that you're not getting anybody else sick is a win. Because people that need care the most right now, if they can go get it. And then if they're good and we have enough time to cycle people out, because if once you get it, pretty much everybody is developing antibodies for the virus and they can't get it again. Right? So we're building up an immunity to it. Yeah. As a species, we all are kind of going through this right now. So the longer that we can draw this out, the more time it takes for things like, healthcare workers on the front lines. That's a real serious thing, right? But if they get it, they become immune after they recover and they can get back into it. So if we can delay things by weeks, months, that's going to save a lot of lives. And that's going to save a lot of disruption too.
Where do you think that people should be getting their information on the updates of the updated information of the virus itself? Do you think it should be the CDC or anybody?
Do not listen to don't listen to the federal government right now, because they are actively spreading misinformation. Right? Like they're going on TV and telling everybody, "Hey, it's fine. Go to work. There's not a problem, Maybe it's better if we all get it at once and then we can just kind of kick this thing and it'll be okay."
So no CDC then.
They're treating this like a PR problem when this is a public health crisis problem. And, their reckoning will come for that. But really there is no time to dwell on the fact that this is a lot of this is their fault. But that's what we kind of really need to do right now. So, I know it sucks to have festivals and things like that canceled. I've got, a lot of my summer work that I usually do. That's all canceled. Maybe,
So where should people go to get their information, though, is what I'm asking.
Let's see. What I'm doing is sourcing this from other, it's a lot of Twitter, right? And there's a lot of other governments around the world that are putting out a lot of really good information. The WHO, that is probably the primary source for all the stuff that's collecting right now and the latest updates and things. I'm subscribed as well to like a New York Times pandemic newsletter that's like kind of giving everybody the latest stuff and updates and shit like that. But really at this point, I'm not sure how much more there is to learn, right? It's right now it's going to be a balance between finding, because there's not a, like these, everybody needs to get prepared now for the life disruptions that are going to come with this, and that are going to come with the measures that we need to take to do this, right? Because in the U.S., it's not going to be like the entire U.S. gets the infection at once. It's going to actually pop up in small communities and little subsets, right? So like it's going on in Seattle right now, and it's not, it's not huge here yet, but it is definitely here, and it's definitely underreported. I've talked to multiple people already who have said, I talked to somebody the other day who said, she was asking me some questions about it, and I said, yeah, no, we should be real worried. And then she's like, oh yeah. And then she's like, I was sick a couple weeks ago. She's like, what are the symptoms? And I'm like, wait, you were sick? Like, And I'm like, what happened? And then she's like, oh, I had a fever. I had the worst like bronchitis cough of my life. Like I was coughing so hard, I was like throwing up. It just sucked, and I was just sweating and just miserable for like a week and a half, almost 2 weeks. And I was like, dude, that is exactly what.
But why couldn't that be the regular flu though?
It could be the regular flu. The problem is that we are basically in a third world country and we have no way of knowing.
Right.
I think it would be. I mean, it's possible, but I'm not banking on that. That was the oh shit, it's time to pull the alarm because it's here, and we all need to be taking these steps interpersonally, and then we also need to be. We need to be calling for all of these things to be canceled, because not canceling them is going to be so much more detrimental than that. And frankly, it's on us to protect everybody who's vulnerable, and it's not just older people.
What about the people who are more concerned about their businesses, their small businesses, staying alive through this? Which, if what we're saying is to stay home and not go out or do anything, then that's it's just going to be catastrophic for that, wouldn't it?
It's this or like mandatory lockdowns. Like it's happening in Seattle. Basically, okay, we've been about 11 days behind Italy, right? Everything started going over there, started happening over there about 11 days before it started happening here. And we're on the same trajectory because that's the way that, this stuff that doubles every 6 days. And I mean, if you look at the numbers in the U.S., we had on February 26th, we had 15 cases. On March 4th, we had 111 cases. And on March 10th, we had 1,000 cases, right? This is going to keep doubling. And we are going to start seeing more and more of it. Right before we got on, they just found out Tom Hanks and Rita Wilson both have it.
Right.
So,
I'm surprised we haven't heard a lot more of that from other celebrities or other people so far. I figure...
Well, again, we only know that because he was in Australia, and that's where he was able to get in a test.
Yeah. So, let's just assume everybody... Like, it's definitely going around, and everybody's got it, and so the idea is, like you're saying, to, try to spread it out so that it doesn't all happen at the same time. So, would you suggest that people who are under the age of, let's say 50, if they get the symptoms, that they shouldn't try to go to the hospital? They should just try to ride
Absolutely
it out at
not.
home?
Yeah, no. If you are not in a serious risk category, do not go to the hospital. Actually, if you think you have it at all, do not go to the hospital. You've got to call first. And unfortunately, really, I would only bother calling if you are like at risk. If you have a history of respiratory problems.
Which is going to be hard, though, because everybody's hypochondriacs' asses are going to be fucking,
That's the thing,
out.
is we can't do that. We cannot overwhelm the hospitals right now. So unless you're in the serious risk category, I say write it out, because I'm sure they're probably already it's starting to happen. And I don't want to make everybody despair, but I mean, like, I was, I looked at some of the translated. What I didn't kind of realize is that, oh shit, in the age of social media, and in a situation where there is such a like powerlessness, it's going to be kind of hard to see this stuff, see kind of what's going on over there, and all this is going to play out in real time. And so I'm, it's very, it's freaky stuff. So that's why this is so important, is that we all need to start taking these steps now. The small business thing. That is kind of why in this country we are uniquely ill-equipped to handle a lot of this. Right? Because we're one of the only countries that does not have, paid sick leave, childcare, a healthcare system. Like the U.S. healthcare system is built for maximum profits. So there's been a giant drive over time to eliminate excess bed capacity at hospitals. And so the U.S. ranks 32nd out of 40 in hospital beds per capita. So it's going to happen fast, and it's going to feel like it happens all at once. And so really the way that we fight this is that if we take measures that seem unnecessary, because that's really what it is. Italy kind of had the same attitude towards stuff, and they're like, oh, okay, you know, it's a thing happening. Oh, okay. Oh, well, we gotta close down. I can't close down, you know, or like, oh, well, I was gonna go that thing, and all of a sudden, like, it just kind of happens, because like I said, it doubles every 6 days. So things are going to just kind of hit us like a ton of bricks. So it's time now for everybody to start making preparations to get ready for this, right? I mean, I know we've seen it. It's all over our own Facebook feeds. People who are losing, gigs and stuff like that, and things that are being canceled. That's going to keep happening. You know, so I think it is. There's a lot of. Look, what we need to do is keep the pressure up also on our government for, relief on this stuff. Because other major countries, Italy, for example, is like suspending mortgage payments. They are, there's talk of guaranteed mandatory sick pay, or guaranteed mandatory sick leave being, written into like an emergency law right now. Now, unfortunately, as of the time of recording this, the Republican Senate did kill that measure, and the president's press conference just now did not really give me any confidence that that was the direction that they're leaning in. Again, they can't. We need to keep the pressure up, and the pressure is going to start building, because they have been lying to themselves about how bad this is going to be. And so I realize that we are actually ahead of them, like kind of no more at the moment. And it's, we need to fight for this. Like, we need things like extending Medicare and Medicaid coverage to everybody. We need to freeze evictions. We need no-string UBI programs right now. We need, we need to get rid of work requirements for SNAP and other assistance. We need humanitarian provisions for prisoners and fucking migrant camps at the border. Like, we need to pass some massive spending measures to keep people on the front lines afloat. And that's the thing, is we're all going to need to take care of each other coming up here, because I don't think everybody is really ready for how much this is going to turn everything on its head. It's mitigating those economic costs is going to be huge, but the way that we we keep the worst of that from setting in is if we do take these measures that feel extreme. Because I mean, I know it's hard. A lot of us live paycheck to paycheck. A lot of us make tips and stuff like that. And I mean, the longer that we don't do that, the more it's going to hurt down the line. So I think it's important that we all take a real sober look at what we're facing, and we prepare ourselves, right?
So what about people? What about people with their jobs? Are you suggesting that they just quit their jobs?
No, I'm not suggesting that, because people can't, and nobody's going to blame you if you do. If you have the capacity to work from home or take these measures, if you're lucky enough to have that, definitely do. And I think it's time to actually have conversations at work about this stuff. I actually just recently, at my job, I just really started pressing this. I kind of said something a couple weeks ago, and I was like, hey, are we doing anything? Do we have a plan? And they're like, okay, no, we'll look into it. And today I was like really pressing. I'm like, hey, guys, this is going to, we need to get ready for this. We need to have a plan in place for everybody to work remotely. And if you can do that, you need to do that. And, you know, non-essential stuff, you know, I think going out, you know, just big public gatherings. I think if we don't need to have it, we don't need to do it. We definitely shouldn't. If somebody, I mean, if you're sick and your job's in the line, it's at risk, or you need that money to get through to the next week, I'm not going to blame anybody who goes for that, right? I'm saying just take a good measure of what you can and can't do. I mean, we really need to think about this. We all need to be having these very hard conversations right now, and we need to be organizing together to take care of each other, make sure we get through this. Yeah, no, the system is set up in a way to where it is impossible. Frankly, it's fucked up that any of us, or that we would ask somebody who's, you know, on the front lines, or just, they're barely scraping by, they work for tips, to not go to work, to sacrifice, to bear the brunt of this shit, because of the fact that we are so ill-equipped here is largely due to the, you know, we're talking about business decisions and giant corporations, and the way that this country has been steered for the last 40 years has left us extremely vulnerable to this stuff. So there is that. What I'm saying is everybody just needs to really take this seriously. If you can, if there's any sacrifice you can make, this is probably the most heroic moment that this country has probably put forward in front of us as a generation, right? In order to step up and do the right thing. Because yeah, we will get through this. That's the important part. We will get through this. We will be okay. And we're going to come out on the other side of this. Me, you, anybody listening to this. There are people that won't. And we're gonna fight our way back here, right? Like, I'm not gonna say it's gonna be easy, but we can do this. And so, you know, big things, little things that you can do, things that I would say, you know, to build up good habits now, like washing your hands properly. I mean, I'm talking washing your hands for a full 20 seconds. And, you know, that is 2 happy birthdays, they say.
Well, real quick, though. So I was listening to somebody else yesterday, and it was a clip. It was on the Joe Rogan podcast. That guy, I don't know what his name is, but he was the first person that kind of put me in the way that you're talking right now, whereas, you know, listening to the CDC, which is what everybody told me to listen to, or whoever else, you know, that says all the other stuff, he was the guy that said that it actually can just be passed on through breathing, by being in the same room as somebody else, and that you're breathing the air that they're breathing.
Yeah.
So what would, like, the washing the hands really, you know, I mean, the washing the, I get it, wash your hands.
Like I said, these are mitigation measures, right? There's no way that, I mean, not to say there's no way, but it is incredibly likely that we're all going to get it, right?
Yeah.
Because there's nothing you can do.
Yeah.
But if, like, the most important, the way that a lot of these diseases spread, and the quickest way it's going to spread, is that it stays alive on contact on surfaces that it touches. And that is, yeah, people can breathe. You know, they can get it on a handrail on the bus, you know? You go and you hold onto the bus, and then you unconsciously touch your face. You just gave it an entryway to get into your body, right? So what's the incubator period for this? Like 3-4 days, something like that? No, it could be up to 2 weeks. That's the one fact that has made this way scarier and way more troubling than anything that we've faced before as far as a pandemic goes, you know? Because you don't know you have it for a long time. And I think you can transmit it during that time too. So even if you feel fine.
Is it possible for people's bodies or their immune system to fight it? Like, completely without getting it, even if they're around people?
I think there's been some evidence of that. That people that are very young too. It's actually it's very strange that like people who are basically under like 10 are almost like immune to this, which is very odd. We're all kind of learning this shit together, so I don't know what to make of that yet. Basically, the high risk categories are 70 and above, people basically 40 and under. Everybody kind of shrugs it off. You know what I mean?
Right.
Like, it's not... it could either be a really shitty cold, maybe one of the shittiest colds you've ever had, but not life-threatening,
Right.
So
another thing is, where the origin of this... no, obviously it's from Wuhan, China, but what... So are we able to rule out all of these conspiracy theories and nuts, cases, stories that people go into about, it being intentionally spread and created by so and so, and with certain motives? Have you heard anything like that, or
I've heard that, and that is preposterous by any measure that I've that I've seen. A lot of people came out very early and said, like, this is not, it's COVID-19 because there's 18 other ones. Like, SARS is another piece of this. Somebody said this was one of the most predictable natural disasters that we could have ever faced, because we know that there's animal to human jumping and stuff like that. So, it's not a conspiracy theory. That is...
And between SARS and this, though, was the main difference just that we were able to somehow contain it earlier?
Yeah, because SARS is much deadlier if you get it. And I think it's a little bit... I think it's harder to spread, but you knew pretty much right away. And so it was... And there was active measures in order to keep this thing under control. So, like, that is how we usually handle pandemics. Again, the president fired the entire U.S. pandemic team in 2018, gutted the budgets, and never replaced them. So that's the situation we're looking at in this country. And so if you look at places like, like Singapore, actually, they were very proactive from the very beginning of this back in December, and they have basically kept their cases. They've had like one death and kept their cases down to like 20, and they took aggressive early measures, and that is looking like that saved them like completely.
What were the measures they took? Did they ban inside and outside travel?
Yeah, they banned it, and then they were able to keep it contained enough to where they could trace who had the infection. That's how we usually stop these things and keep them from going out. That's why Ebola, SARS, all this stuff was fine, because it doesn't actually leave the containment area. We know who was infected, and we know who got them infected, and we're able to follow these people, make sure that they don't infect other people, and wait it out, help them, and so they get better. The problem is that ship has sailed. That ship sailed a while ago, and I barely any country in the world has actually been able to accomplish that. But it's definitely here.
So but what has their economy, were they able to be stable, remain stable, or did they take a big hit? What were some of the results from that?
I think they're a little bit better off than us, but the truth is that it's a global economy. So even if we had all the right measures, our interdependence with places like China and other places around the world, that means it's kind of everybody's getting dragged down at the same time. And so
do you think that Disneyland should just close indefinitely?
Yes, absolutely. Disneyland should close right now.
Would they ever try to force them to do that? Or do you think that would ever happen?
Yeah, I think so. They started to lock down places in Washington, around those areas where the outbreak is the worst, because I think they were really like the first big epicenter of it. New York, I think, is probably about to go on lockdown too. So it can happen here. Now, it's difficult to enforce all that. But
right.
And lockdown also does not mean like I also the thing that made me feel like we're going to be okay is when I saw a couple weeks ago that in Wuhan, China, their KFCs were still functioning. I'm not kidding. Now it's a little bit weird. They had like everybody had gloves on, and they're using a touchscreen to order, so they don't actually have to like see each other there. Everything's very sterile. And then like they had like a delivery driver go and drop something off, and they put it in like a neutral space. They'll like drop it off, and then they walk away, and then the person who was picking it up walks and grabs it and walks back in. So it's like life is going on. If you look at where it was the worst in China, they still kept it together, right? Now they have a lot of capacities that we don't to keep a lid on some of this stuff, but I still believe in us, because even though the federal government has completely, catastrophically fucked this up, we do have very competent state governments, very smart ones too. And especially in this state, in California, we are the fifth, we're like the fifth largest economy in the world. And we have a giant budget surplus. We are actually making more money than we're spending. And so we have the capacity to take care of everybody. We could, and there's definitely talks about this right now. Gavin Newsom at the head of all this. I'm thankful for him this month, because I do have more faith that there are going to be some measures taken to protect people from evictions, to protect people from lost wages and things like that, to keep food together, to keep emergency hospitals and bedding together. The state has been pretty proactive in managing this crisis. They are taking action way quicker than some other places are. And so that is definitely it's reason to temper down a little bit, to understand like, hey, we're going to get through this. It's going to suck, but we are going to get through this. And we need to take care of the people who we know that are vulnerable. It was tough. I went over to my parents' house the other day, and I was like, look, I can't. I don't think it's a good idea to get next to Grandma. And I could tell she was so scared. And that's really hard to watch, but we need to do everything to keep ourselves healthy so that we keep everybody around us healthy. And that this thing trickles in. And luckily we had a bigger head start than almost any other country in the world. And now a lot of that has been squandered by the federal government's response to this. But there are a lot of people who have been on top of this since the beginning. And I think California has been on top of, we need kind of pop up emergency rooms and things like that. And all of us individually, we need to understand that we can't just bank on a savior. So we need to be making sure that we are taking this very seriously and that we're doing everything we can to prevent this stuff.
Now, one more thing about the actual virus itself. It was said in something that somebody shared, like coming from China about a week ago, that the virus won't last through severe heat. Is that true, or is that a myth?
That's a possibility. So that is how that's how the normal flu works. It can't thrive in heat, but it comes back during the winter. So, with any luck, I don't want to get everybody's hopes up or nothing like that, and I don't want to bank on it, but with any luck, if it gets hotter here sooner rather than later, yeah, we could actually see the virus start to dwindle down and start to go away for the summer. And if that happens, that would be enough time for people to get it in small batches, small doses, for things to even out more and to flatten the curve. That's the theme. We got to flatten that curve. Because you imagine the bar graph of everybody, kind of going upwards and stuff. You know what? Fuck it. I'm gonna make that the episode thumbnail. All right, the curve, so everybody can see what I'm talking about. We need to flatten that out. And so if summer hits and this virus reacts in the same way that other ones do, yeah, we could definitely see that. We could see it reside. We could see things smooth out, and we can definitely ease the impact of what would happen. Also, once enough people get the virus, like pretty much everybody recovers, and then we build up antibodies to it, and so that we're not getting it again. So once enough people get the virus, we start to build up a herd immunity to that, so that the virus cannot find anywhere to attach to. It starts to die out more naturally on its own, and we're going to see a giant slowdown of cases. Now, like in Wuhan, cases are already slowing down dramatically. Japan, cases slowing down a lot too. There are places in the world to look that, that are more hopeful,
Right.
And then we are probably about 17, 18 months away from a vaccine, which I think will finally get rid of this thing completely.
Yeah, and it'll be yours for the very low price of $100,000.
Well, luckily enough, there is a provision in the Affordable Care Act, Obamacare, the same one Republicans are trying to kill in court right now, but they will not be able to kill it before this part takes effect. But there's a provision written in there that says that if there's a major pandemic outbreak and we develop a vaccine, we need to make that vaccine available for free to everyone.
Right.
And so, yeah, this politics and legislation shit's real important. So yeah, no, that part I'm not as worried about. And we might all spend some time hauled up together. So we'll share some good movies to watch. We'll kick it. There's gonna be a lot less festivals and things like that to go to this season. So fuck it. Let's we can be couch potatoes together.
Yeah, I mean, at the end of the day, if that's all that we have to lose from it, then that's, not so bad. But a couple more things I think that are very simple that could be added to go along with, the 20-second washing of the hands and those sort of things would be to stay away from iced drinks or cold drinks, right? Drink hot water, hot liquids, because supposedly that's better for you, so that the disease doesn't spread as quickly. Is that something that you
I have
heard?
not heard that, but
that was something I read from several places that was something definitely the water, just try to avoid ice, which makes a lot of sense now why a lot of people in the last year I've noticed it was a much bigger trend in restaurants where people order water without ice, like specifically ordering it without ice. In all my years of serving, I definitely noticed a rise in that sort of thing in the last year or so. And hey, maybe, they're onto something. I personally drink hot water with lemon every single morning. And I am thinking that with the way that I am and how much I'm out and about doing all kinds of stuff, especially how the fact that I haven't gotten sick in the last couple of years at all, like since I've started doing this, that is certainly something that is beneficial and, just a little something that you could do to try to add to, just another precaution that you could take. So doing that each morning. Plus it's good for you, fucking good for your stomach, your immune system in general.
I wholeheartedly endorse that idea because that's fine. Like the important thing is also not to panic. Don't go out panic buying masks. Don't go hoarding toilet paper. I don't know who to equip with that. There's no reason to think that we are going to see major supply chain disruptions that are going to actually stop us from getting food and shit like that.
Right.
Yeah. If you know somebody that's obviously the situation changes if you know somebody who is like immobile or has special needs or something like that. Yeah, then please do go out and make a plan. Make sure things are safe for that. But like I'm not stocking up on food. I'm not going too crazy with it. I am, in a lot of ways still kind of going about my life. There's just a couple things that got to change, and I know my summer plans are going to be a lot less interesting, but I do believe that we are going to be okay, but it is important not to sugarcoat things, and it's important that we very clearly communicate the risks so that everybody knows, hey, this is serious. Like, I get it. I was just shocked the other day when people are still, spreading memes like, oh, okay, they told me to be worried about SARS. They told me to be worried about Ebola and shit like that. I'm like, no. That's not the thing to worry about, really. So that's why I think it was important to take a very real look at what could happen and what's probably going to happen and what we could do to stop it.
All right, guys. So that means no more Corona memes about the beer, or just memes in general, or joking around. It's not even funny.
We can joke. Once everybody gets it, how serious this is, then we can go back to jokes.
Well, I'm saying mostly because they're just not even funny.
They're
anymore.
not good. Yeah.
Yeah, a lot of them are really bad. It was funny for like the first week, and then it's just kind of, it's one of those things that this is part of the virus, having to deal with the stupidity that goes behind it. One of the better memes that I did see was one from Men in Black with Tommy Lee Jones and Will Smith, where he said, a person is smart. People are dumb. And I hate to say it, people, but as a whole, we need to do a lot better. We need to stop going to fucking Costco and hoarding toilet paper and water as if that is going to protect you from the fucking virus. I think perhaps the best meme was when there was one where a guy with the doctor there, and the doctor's like, yeah, you have the virus, and he's like, that's impossible. I have 400 cases of water. And so, like, it's just like, this is unreasonable. So stop doing that kind of shit. You look stupid when you're racing in Costco for that kind of stuff anyways. We should all just convert over to bidets now anyway. This is a clear sign that toilet paper is out and bidets should be in. I've heard nothing but great things from people. I heard that once you go bidet, you never go back. So we should all consider that. Maybe that should be something that
I'm really disappointed that wasn't once you go bidet, it's here to stay. But
okay. Well, that I'm not as clever and witty as that. I'm just too busy thinking about my butthole getting cleansed right now.
I can't wait for the toilet paper shortage just to have an excuse to shoot hot water in my asshole every day. That sounds delightful and very clean.
If you're privileged enough to have something like that, I think that's something we should write or talk to to whoever.
I've got a shower
talk
and
to
I'm
our
very
officials.
flexible.
Oh, well, yeah.
That's all you need. Just a little ingenuity.
I've seen it.
Anyways, go watch some clips, some TikToks. I don't know if that's what you do, but go watch those of there are people in people who are in quarantine, bored, making kind of ridiculous shit, and we all need each other for this moment, right? So let's not forget to laugh. Let's not forget to have fun, and let's just be there for each other as well.
This might truly be the best blessing in disguise for me, because I have so much creative shit that I need to get done, and staying home would certainly allow me to do so. But I fear that my job, being that I'm the only one that has to actually show up, is going to be like, you still got to show up. So, we'll see. Nobody comes into my spot anyway, so I'm pretty good. I think I'm chilling there. I'll just play my synthesizer like I did for 2 hours today when nobody walked in. So, anyways, let's stay safe out there, everybody. Let's not wish or hope for the best. I have a lot of things to reconsider now with all of the things that are coming up that I'm part of.
This is this is the most awkward plugs segment that I think we've ever run into.
Yeah, so, for now, it's going to have to be stay tuned, because I saw one of the events that I was going to that I wasn't actually plugging for myself or anybody else, but one I was very much looking forward to, a local underground one, kind of surprised, but it looks like the city of San Bernardino has advised them not to do it, and so that is on hold. And at the very same time, there, as some of these are kind of dropping out, it is kind of a relief, because it's like, well, I don't have to stress about getting there or doing that. You know, it sucks. I don't want to, make anybody bummed out for the people who bought their Coachella tickets or wherever. I personally have a lot of friends that are suffering from that, but I really do feel bad for the people who are dependent on gigs like this for work. So if you know anybody like that, now is the time to support your artist friends more than ever. Now is the time to go and really, donate what you can to them just out of the goodness of your heart. But, if you can get something in return from it, cool. But now is the time.
Like that.
We
need to help each other out.
We cannot let this madness, really just devour our spirits, and we cannot let it remove the one good thing that we have, which is, art in whatever form. We need to remain, we need to have stuff to keep us occupied. We can't just get to lose ourselves to madness over this. So, stay safe out there, everybody. Do you have anything that you want to plug personally right now, Phil?
Not anymore.
Well, yeah, so, as I said, we do have Art in the Park planned for this month on the 22nd, but definitely going to be going and discussing with the team and seeing what's going to happen with that. As far as I'm lucky, I'm not going to anything major or big, which obviously would be much more at risk, I'd say, right? Yeah. We'll see. We're gonna figure this out.
The problem is they shouldn't have tried to hold an election and teach Americans how to wash their hands like in the same week. It was it was too much. We got overwhelmed.
Yeah. So, pay attention, people. These are reasons why voting matters. These are reasons why it's important to know who is making the laws, because it's probably going to get real quick here, and things aren't going to be as funny or as nonchalant as they used to be. So get with it.
But we will persevere.
Yeah. Anyways, thank you all for tuning in. We don't want you freaking out. Go out there and do nothing anywhere out there, actually. Stay in there. Stay in there. FaceTime your friends, because you can't send the viruses through FaceTime. Just hang out and check
in with the folks who are vulnerable right now too. I'm sure it's gonna mean a lot. Like, don't panic them, but they're scared. So take the time. Take the time to just be with them, help them out.
Yeah. And I'm going to be assigning homework for people while we're on our, on our little homestays, because you're not just going to get off the hook by doing nothing, watching Netflix and shit the whole time. You guys are going to do some creative shit. I'm going to come back with some assignments.
All right.
Anyways, thanks for tuning in. We hope and wish the best for all of you out there. Stay safe, and until next week, let it bleed.